Magandang hapon sa tanan, or good evening, or good afternoon, everyone. I hope everyone's doing good. Wanted to reach out this afternoon and talk about something else about considering early retirement and something you want to think about in planning where your destination is going to be. Of course, if you're married to a Filipino or a Filipina, then of course you're already leaning towards coming to the Philippines. But if you're married to an American spouse and you want to retire and you want to stretch out your US dollars to the best you can and get the best life you can, then you may have other options. But something to consider is healthcare. I can't really touch on the healthcare in other countries outside of the US as much as I can with regards to the Philippines, because the Philippines I have personal experience. But I will say this much: if you're retiring in America, your healthcare costs, if you have medicine or even any ailments that requires medicine or frequent hospital visits or doctor's visits, you're going to pay even during retirement. And you will not be able to do an early retirement in the US. It'd be almost impossible because you need Medicare. And if you retire, private insurance is going to be high. I know there's laws against pre-existing conditions, but still medicine and things like that will be extravagant, and you'll have to have a high deductible. So it's just very costly. I know for me and my family, I was paying $1,800 a month. And there was no way I could retire paying that in America. I would need Medicare and certainly supplemental Medicare insurance. What I've seen working in the ERs and ICU for many years, doctors don't have much time, and a lot of times they rely more heavily on their residents and other medical students to come in and do more thorough exam. I will highlight this one example. My daughter was born here in the Philippines almost 16 years ago, and my son was born in America. My wife's doctor here in the Philippines graduated from Harvard. I found that very odd. I'm like, how can someone from the Philippines afford a Harvard schooling? That's unheard of. But through the years, I've found that the government here provides sponsorships and scholarships to Ivy League schools. And it's amazing how many doctors here actually went to Harvard, Cambridge. They went to some of the other Ivy League schools. Princeton was another one that I found here. But my wife's doctor was from Harvard. Very well respected and liked facility, and their education top notch, right, in Ivy League school. But she knew her stuff. And my daughter was born in Tagum Docks Hospital. Had an awesome experience. All the care, everything else was natural delivery, and all the care was less than $2,000 US. So I'll go over a little bit more about the healthcare here. If you're considering going overseas, like into Mexico or whatever, I know there are a lot of people travel over other countries for their healthcare, and this is just one example. But I'll tell you about the healthcare in the Philippines. So, healthcare in the Philippines for expats, provides like a mix between public and private options. Now, with the private healthcare, it's typically the preferred choice, and that's because they provide higher standards of service and they have higher facilities, higher levels of care. The public health system, we'll go over that first. It's the PhilHealth, the National Health Insurance here. It's a program that provides basic health coverages to Filipinos, and you can, as an expat, you can buy into that. The typical cost, I think, is about $300 a year, so it's not really that bad. But as long as you have a valid visa, you can enroll into PhilHealth for that. I don't personally, but you can buy other insurance. The quality of care, public hospitals and clinics, they're more affordable, but you still may have to provide some, a little bit of money, maybe not as much as the private, but you have to deal with overcrowding, long wait times, and certainly limited resources, especially in rural areas. Now, and the quality of care is much better in private hospitals, especially for expats. But you can find private hospitals in like Manila, Cebu, and Davao. They provide world-class medical care with modern facilities. The staff are English-speaking, and it's often the preferred choice of care for expats here in the Philippines. The cost may be a little bit more expensive, but still way more affordable than in America. And you can buy an insurance that you can go online, look and shop. As long as you buy an insurance that excludes the United States, it's cheap, very cheap, and it pays very good. But if you have it including the United States, your premiums will skyrocket. Healthcare in every country in the world is way cheaper than America. America is some of the most expensive you'll ever find. And that's why this insurance company requires you to exclude the Americas. And it makes it way more affordable. They have MRIs, they have CT scans. And to have a CAT scan here is like, for me in Tagum Docs, the last time I went, it's like 13,000 pesos. So that's a little bit over $200 for a CAT scan. So certainly a lot cheaper than in America. I think in America it was anywhere from $900 to $1,200 without insurance, depending on if there's contrast involved and all this other kind of stuff that goes on. So it's way cheaper here. But there are some facilities in Davao, some facilities in St. Luke's and Manila that offer the very excellent care here in the Philippines, and it's much more affordable there. Now, I'll tell you about this about the Philippines. The Philippines is a very popular destination for medical tourism. A lot of people from all over the world come here for medical care just because it's cheaper and it has state-of-the-art facilities here in the Philippines. Now, you need to do your research, your homework, and everything else, and don't take it for face value, what people tell you. Check it out for yourself. Go online, do research. And then always check where they were licensed at. I mean, where do they go to school? Where do they study? And then what's their level of experience? How many surgeries have they performed? How many things have they done? You know, how long they've been being a doctor? You know, how long they've been rendering care, and all that. So do your due diligence and do your homework. You need to do that even in America. So major cities have excellent healthcare, and people come here for cosmetic surgery, dentistry, certain wellness visits, and things like that. Now, the rural areas, you'll have a little bit more difficulty finding healthcare. You'll need to travel to one of the bigger cities to get good quality healthcare. And so that's one thing you need to consider. But insurance is certainly way cheaper, you know, to get it. Emergency services, they vary here as well. You know, many expats here keep a list of trusted hospitals and emergency contacts just in case something was to happen. Because ambulances here are not very quick, and you'll have a better chance of getting transportation, getting someone to drive you to these facilities a lot faster than you can expect an ambulance. And there certainly is no 911 here in the Philippines. Typically you can call 911, but the addresses are not there. You won't be able to have a 911 address. You'll just tell them whereabouts you are located, and at this big tree, this coconut tree, and this color house, you know, there'll be somebody sitting out front. Yeah, generally that's what it is. here. As far as medicine goes, yes, you can easily get medicine here. You can get medicine very well, very easily here. In fact, you can go to the pharmacies here, and most medications you don't even need a prescription. You can just walk up and talk to the pharmacist, say, I want this medication, that medication, and they just give it to you. So how many milligrams, how much do you want? And you know, it can vary in prices. It's certainly not very cheap. Medicines here are not very cheap, but depends. There again, it depends on what kind of medicine it is. But it's certainly way cheaper than it is in America. That I will tell you. But there again, you just have to do your homework and shop around and see which one's your best options. But if you want to move here or move anywhere and retire early, that's something you need to consider is healthcare and where you want your healthcare costs. And certainly, being an expat over another country, your dollars will go a lot further, especially with healthcare. And you can get just as good, if not better care, if you do some planning and do your homework, and you can in America. So let's just give you a little insight. So thank you guys for watching. If you haven't, I hope you like this content. If you haven't already subscribed, please consider doing so. Please like and share this video. That will help me a lot. And as always, remember, life is short. Make the best of it.